Well, thank you so much. It's really great to be here. I was delighted to find out that this youth event goes for people up to the age of 29, which makes me nearly a young person. Not quite, sadly, just over, but nearly, which was very exciting. It's also great to be in a place in North America where people know how to spell the words color and favorite. Thank you. No offense to any Americans in the audience. I hate you. It's nothing personal. I just really strongly dislike you. I'm joking. I was in America a couple of weeks ago and I said the same thing about Canadians, so it's really nothing personal. Sorry, that was a joke. I didn't really say that. Okay, so today we're going to be talking about the abortion pill. Probably most of you are familiar with these sorts of conversations. It's been a huge topic of debate all over the Western world, really, and has been something that has been particularly promoted during COVID because it means that you don't always have to see someone in person. And so I'm going to really be sharing some of the evidence behind this about abortion pill reversal as well. And then, I don't know how many of you were at the march yesterday, probably most of you. You may have heard a little bit about my own journey becoming pro-life while I was at medical school. And so at the end, I just want to share a little bit about what it was that changed my mind when I was at medical school many years ago. So it's going to be pretty kind of information heavy, so I hope it's useful. This isn't going to be a talk full of jokes. I will try and do some, but English people are not funny. I will really try and break it down, though, so it's something that you can really easily understand and hopefully will be useful for arguing about these sorts of things in particular, because this is an area where it's not only the unborn child who is at risk, it's also the woman herself who is being put at risk by some of these dangerous policies, and also women who are being denied a choice to keep their baby when the evidence suggests that they are able to. And so I'm going to be talking a little bit about that. I think it's first helpful to start with just a really clear understanding of the terminology in this. What do we actually mean by things like medical abortion or home abortion or telemedicine abortion? Because these are all different things. So medical abortion is also known as chemical abortion or drug-induced abortion or abortion by pills. This just means that you have the abortion without any surgery. There's no vacuum, there's no dismemberment. You take the pills, and that effectively causes a miscarriage. And traditionally, that was done in a hospital setting. It was done supervised. It was done really in a very sort of regulated way. And so medical or chemical abortion itself doesn't have to be completely unsupervised. It didn't used to be, but that's what's happened more recently. And what this involves is the administration of two different pills. The first is called mifepristone, and what mifepristone does is it blocks progesterone. Now, think of progesterone as the thing that is pro-gestation. That's why it's called progesterone. It basically is a hormone in the body that helps the body keep a baby surviving and keep a baby comfortable. It's pro-gestation. That's the point of it. So mifepristone blocks that, which usually ends the baby's life. Not always, but usually mifepristone alone will end the baby's life. But then a second pill is taken 24 to 48 hours later, 1 to 2 days later, called misoprostol. And misoprostol effectively causes the uterus to contract, which means that the baby leaves the womb. Again, it is usually dead already by this point, but sometimes it is not. If it's not, then the contractions caused by the uterus will normally kill the baby. Even then, sometimes it fails, and sometimes you get a live baby after taking these pills. Very rarely, but it can happen. Sometimes the pills don't work at all, and the baby stays inside the tummy and is perfectly healthy and survives until birth. So that is how this works. Sometimes you need to take multiple pills of misoprostol because the first time it doesn't work, and you need to keep taking them in order for a miscarriage to actually occur. So that's the basic principles behind how a medical or chemical abortion works. Now, the reason it's called medical abortion isn't just because it's sort of a euphemism and pretending that abortion is healthcare. In medicine, we distinguish everything into either medical or surgical. Surgical means that you use like instruments or you go inside the body kind of with your hands or something like that. And medical just means it's done without surgery. So that is why you hear a lot of people, even pro-life people, calling it medical abortion. It's not because we really believe that this is healthcare or that it's medicine. It's just to distinguish it from surgery. So what does home abortion mean? Well, home abortion means that you do some of this at home. Now again, traditionally that was still regulated, and traditionally you would still take the mifepristone, the first pill, in a hospital or in a clinic supervised by someone. And then the woman would go home, and 2 days later she would take the second pill at home. And so there was still some regulation when they began to introduce home abortion a few years before COVID. And then finally, the slide again, if we have telemedicine abortion, this is something that is really quite new. It's only really been done illegally for the past however many years, maybe 20 years or so, or it has been done legally in the last couple of years, since COVID, in many countries across the Western world. What this means is that the woman never sees anyone in person. She doesn't even go for a history taking. She doesn't even go to answer questions or do anything in person. She calls up the abortion provider, says that she's pregnant, says when her last period was, answers a few questions, and then they send her the abortion pills at home, and then she has the abortion all by herself at home with no supervision. And so that is what has been at stake during COVID, and of course COVID was the excuse to do this. They said we can't send people into hospitals or clinics because it will be dangerous because they'll catch COVID. We have to just send these pills out to the public with as few questions asked as possible. So what are the issues with this? Well, I've published a couple of papers on this topic, and I want to just outline some of the safety issues that are putting women at risk from telemedicine abortion specifically. Now, medical or chemical abortion has its own problems. Home abortion is more risky because the second pill is unsupervised and women sometimes take it at the wrong time and so on, and they can bleed afterwards. Telemedicine abortion is something far more dangerous still, and so that is what has really been in heated debates in the last couple of years because it is profoundly dangerous to the well-being of women. And here are just some of the ways. I won't go through all of these, but I'll try and summarize some of the key reasons that telemedicine abortion is dangerous for women. Now, what's interesting is that just before all these governments in the West introduced telemedicine abortion, which you might know as mail-order abortion or pills by post or DIY abortion, these are all the same thing. The Cochrane Library, which is a very well-respected database in the UK that basically analyzes the evidence for any intervention. They are really the gold standard in medicine, looking at any intervention and what the evidence for it is. They're not pro-life or anything like that. They're really, really well-respected. In 2020, at the time that these policies were being introduced, they concluded about home abortion the evidence for the safety of these interventions is very low. Now, that was about home abortion, which is more regulated than telemedicine. Because remember, at home abortion, you still see someone in person to begin with, you take the first pill under their supervision, and then you only go home for the second pill. The evidence for the safety of even that was thought to be very low. So telemedicine, which was far less regulated and far more dangerous, is an extremely rogue and dangerous move, and based on really no evidence base at all, or at least no good evidence base. So what are the issues? Well, the first is a safeguarding issue. And the basic issue here is that if you ask for pills over the phone, how can anyone tell whether you are speaking alone? So what I mean by this is the following. If you go to Marie Stopes' website, is Marie Stopes big in Canada? You have them or not really? I'm seeing blank stares, so probably not. So they're one of the biggest abortion providers in the world. The two biggest abortion providers in the world are Planned Parenthood and Marie Stopes. And Marie Stopes says on their website, in the frequently asked questions, because many women ask this question, I'm being pressured into having an abortion, what should I do? It's interesting that this is a frequently asked question, but the answer that they give is that the decision about whether to continue or end the pregnancy is yours to make. If you feel that you are being pressured into having an abortion, please let us know. We will not provide treatment unless you are certain of your decision. As part of an abortion appointment, you would have a private consultation before treatment away from anyone who has accompanied you to the clinic. So what they're basically saying is that if you are a victim of coerced abortion, or we can extend this to domestic abuse more generally, or human trafficking, don't worry, because we will make sure, we will guarantee that we will see you in private alone so that you can tell us the truth without any coercion. This is what they promise, and it's still on their website in the UK. They promise this to women. But of course, if women are speaking on the phone, how can they possibly promise this to women? It is very easy, and we've had videos of simulated situations where an abuser is sitting there by a woman, the woman is speaking to Marie Stopes on the phone, asking for abortion pills, and they have no idea that someone else is in the room, and they agree to send the pills out. There is simply no way they can guarantee that a woman will really be seen in private, and this puts those women at clear risk by their own admission for coerced abortion, and as I said, this can be extended to situations of domestic abuse or human trafficking. In fact, pretty much everyone says the same thing. The Royal College of Obstetricians and Gynecologists says that clinicians must be confident the women can speak privately without coercion. This is in their abortion guidance. BPAS, which is the biggest abortion provider in the UK, say, "We always see the woman alone on her own during the consultation to make sure that she is happy with her choice." These are the words of everyone that is supporting abortion in the UK and that provides abortion. They say a woman has to be seen alone for her safety. And now they are going back on this. This was a particularly interesting result. This was from a different context, but it's the Faculty of Sexual and Reproductive Health, which is one of the leading proponents of abortion in the UK. And they did a survey of 1,000 providers of sexual and reproductive health during COVID. They surveyed over 1,000 members, all people who worked in sexual and reproductive health. And one of the key concerns that people had about telemedicine, about not seeing patients face-to-face, was that they worried about domestic abuse in particular. They mentioned the limited ability to identify signs of domestic abuse through remote consultations. As the evidence clearly shows, the closure of sites and lack of face-to-face consultations are having detrimental impacts on sexual and reproductive health care of vulnerable groups and women specifically. And women generally. And we call for a reversal of closures and gradual reinstatement of face-to-face consultations. This is the most clear and explicit and unambiguous statement from one of the leading proponents of abortion in the UK, that not having face-to-face contact with clinicians means that vulnerable women who are victims of domestic abuse were not being identified. And we know that a quarter of abortions are forced on a woman against her will by someone else. We know that human trafficking victims are very frequently given abortions against their choice, because that is the only way that you can keep people in work if they're being victims of human trafficking, and is the only way you can remove evidence of sexual assault, by removing the DNA evidence from the baby. So this is hugely important because there are thousands and thousands, tens of thousands in Canada alone, of vulnerable women who are being pressured into having an abortion, or some of whom are being trafficked, and who will not be identified because their pimp or their abuser is going to be sitting on the phone with them, forcing them to ask for abortion pills. And this is by all of these abortion activists' own admissions. Okay, so the second problem with telemedicine abortion is the problem of ectopic pregnancies. Now, this is where you get a pregnancy that is not in the womb, but is actually in the fallopian tube, or sometimes even somewhere else, in the abdomen, for example, in the rest of the tummy. This is extremely dangerous because the baby, of course, is supposed to grow in the womb. That's the only safe place for it. And so if you have a baby growing in the fallopian tube, the fallopian tube cannot support the baby except in very rare situations. And therefore, the pregnancy will usually rupture, and it will burst the fallopian tube, and it will cause massive, massive hemorrhage, which can end the life of the woman. And it's one of the leading causes globally of maternal death. So it's a very significant problem. And 1 to 2% of pregnancies are ectopic pregnancies. So it is common. It happens in 1 in 50 pregnancies. So that is thousands and thousands of cases. It's very, very common. Now, to rule out an ectopic pregnancy, to make sure that the woman doesn't have one, you have to do an ultrasound to see where is the baby, where is the pregnancy located. But of course, if you have someone calling on the phone and being sent the abortion pills, you never have an ultrasound, you never have a physical examination. And so people with ectopic pregnancies, with a baby in their fallopian tube, are going to be sent abortion pills to their house. They're going to take the abortion pills. The abortion pills won't do anything because the pregnancy is in the fallopian tube, and therefore the pregnancy will eventually rupture and burst, causing a massive hemorrhage. This will put the woman's life at risk, but not only that, because she has been told when she was sent the pills, you will feel some pain in your tummy, in your pelvis, and you will get some bleeding. She thinks that her ruptured ectopic pregnancy is normal. She thinks, well, I was told to have pain, I was told that I would have bleeding, so this is just part of the abortion. So she is sitting there with a hemorrhage filling up her tummy, causing an immediate life-threatening situation, and she is sitting there thinking, this is just the abortion, it's fine. Now, we know that women around the world have died as a result of this situation. We know that women have nearly died in a variety of Western countries as a result of telemedicine abortion, so it is profoundly dangerous. Likewise, in order to tell how far along the pregnancy is, you need an ultrasound. You need an ultrasound to see, is it 8 weeks, is it 12 weeks, is it 20 weeks, or is it 38 weeks? And this is not crazy. Most people can tell when they have a big pregnancy bump, and they know that they're very, very far advanced in their pregnancy. But occasionally in medicine, we see someone who does not know they are pregnant until they give birth. Now, that is really an incredible situation, and fortunately it's not very common, but it does happen. So in order to know how far along the pregnancy is and how safe the abortion pills are, because you definitely shouldn't use them unsupervised late in pregnancy, you have to do an ultrasound, or at the very least, an examination, a physical examination, to see, is this woman in the first trimester, the second, or the third? And that really has a big impact on how she should be treated or managed from a medical point of view. But of course, this doesn't happen under telemedicine, and so in the UK, we have seen cases of women and even teenage girls giving birth to babies in the third trimester at 30 weeks or so, at home with no supervision, no antenatal care, just because they've been given abortion pills over the telephone. Again, this is clearly incredibly irresponsible and dangerous, and is happening to women and girls in the UK. And this is just really remarkable, so remarkable, in fact, that in one case, the baby was so far advanced and was so tough and big that the baby survived the abortion pills, and the baby was born alive in the third trimester. The baby subsequently died because the woman expected an abortion and didn't give it any medical care or anything like that, and therefore a murder investigation had to be opened by the police because a live baby outside of the womb had died. So not only does telemedicine expose women and girls to these safety risks, it also puts them at risk of being prosecuted for murder, and this would be the law if you have a living baby outside of the womb that dies as a result of your neglect or anything like that. It is considered homicide or murder or, what's the other word? What am I forgetting? Manslaughter. And so this puts women not only at safety risks, but also of massive, massive legal risks, potentially from giving birth later on in pregnancy. And there are other conditions related to gestation which also make it more dangerous. You also need to do a physical examination to look for other things that the woman might have, other conditions which might make a medical or chemical abortion more complex or even more dangerous than it ordinarily would be. For example, in 2012, the WHO said that you have to do a physical examination before doing any kind of abortion to look for things like fibroids, twin babies or triplets, pelvic tumors, anemia, malaria in some countries, and infections of the reproductive tract or of the genital tract. Because if a woman has any of these conditions, you cannot just give her abortion pills and as normal. You have to treat her in a more careful way and be aware of these things. With some of these conditions, you should not give abortion pills at all from a sort of safety point of view, safety of the woman. Of course, you should never give women abortion pills generally if she has a living baby inside her. But these make it even more dangerous for the woman herself. And of course, if you are sending the woman the pills over the phone, then she will never have those conditions picked up, and she might be going through a medical abortion when she has anemia, for example. So suppose she has anemia, she has not enough hemoglobin in her blood, you give her medical abortion pills and she has a big hemorrhage because of the pills. She was already anemic, and because she has had a hemorrhage, it becomes life-threatening. And so that is why you need to do examinations and ideally blood tests like this to make sure that it is safe to give the woman the pills. Okay, so I won't go through some of the kind of studies that have been done to try and show that telemedicine is safe, but those studies do exist. If you want to kind of know how to respond to those studies, which say, actually, we did a load of studies, none of the women had complications, they were all fine, on my website you can get plenty of information about that, but I won't go through it this morning. In terms of the politics, what's remarkable is that it wasn't just pro-lifers making these points. It wasn't just pro-lifers versus pro-choicers, and of course the pro-choice side always wins in the mind of the authorities. The UK government, after introducing telemedicine abortion at the start of COVID, around 2 years later admitted this is not safe. There are women who are victims of abuse and who are victims of coerced abortion who are not being identified, and so we are stopping telemedicine abortion. They recognized that it was not safe, and the UK government is firmly pro-choice, but they said this is not safe for vulnerable women. So they recognized this. Unfortunately, our parliament voted on telemedicine abortion, and some of the government defected from that position, and so we have telemedicine abortion once again. But the government, pro-choice, said that they will not have telemedicine abortion anymore. Likewise, our National Health Service's child safeguarding authorities, which has a long name I won't go over, our child safeguarding authorities in our health system not only said this is unsafe behind, closed doors, they didn't just say it once in a statement by accident, they actively campaigned to stop telemedicine abortion for children and vulnerable young adults. They said this is not safe, and it is so risky to women that we are going to put our own professional kind of reputation and friendships on the line by advocating politically against this, because it is so unsafe. Not only them, but the Royal College of Pediatrics did the same. They said this is fundamentally not safe for children and vulnerable young adults. We have to get rid of it. And they lobbied the politicians to get rid of it, even though all of these bodies are pro-choice. That is how unsafe it is, that you have major pro-choice medical authorities, leading medical authorities, saying this is not safe and you have to put an end to it. But of course, no one listened because politics. Okay, well, what's the good news in all this? Well, the good news is that the shift towards medical or chemical abortion means that there is now an opportunity to stop it halfway that we didn't have before. This is called abortion pill reversal. Show of hands, has anyone heard of abortion pill reversal? Okay, a good number of you, good. So, how does this work? Well, you can see the results. This is one of my friends, Dr. Dermot Carney, who's a doctor in the UK as well, from Ireland originally. This is Amrita and her baby, and the baby was saved by abortion pill reversal. Amrita had gone to have an abortion, but she changed her mind after taking the first pill, and she said, I need help, where can I get it? Dr. Carney prescribed progesterone, and therefore the baby was saved, and the baby, as you can see, is nice and healthy and happy. Doesn't actually look that happy, but I assure you he is to this day. So what do the kind of pro-choice medical authorities say about this? Well, the American College of Obstetricians says this is not supported by science. It is unproven and unethical. The Royal College of Obstetricians in the UK says there is very little evidence to show that a treatment with progesterone will reverse an abortion. So what does the evidence show? So this is how it works. The baby is in the womb, the baby is hooked up to the placenta, which is kind of tied to the uterus. And as I said earlier, a medical abortion or a chemical abortion works first by taking mifepristone, which blocks progesterone and so begins to break down the lining of the womb and inhibits the placenta, so it causes the baby to die. Then 24 to 48 hours later, you're supposed to have the misoprostol, which causes contractions so that the baby will be ejected in a miscarriage from the uterus. That is how it's supposed to work, and as I said, you can take multiple doses of misoprostol if the first one doesn't work. So what is abortion pill reversal and how does it work? So the first step, there are two steps. The first step is very simple. You just don't take the misoprostol. You wait 24, 48 hours, and then when you're supposed to take misoprostol, you say, no thanks, I want to keep my baby. Hopefully it's still alive. If you don't do that, if this is all you do, you take the first pill and not the second pill, there's maybe a 20% chance, maybe 10 to 25% chance that the baby will survive just because you didn't take the misoprostol. And this is standard treatment. So if a woman takes mifepristone by accident during pregnancy, or if she's forced to have mifepristone and she goes into a hospital and says, I don't want an abortion, the standard treatment is just to say, okay, we'll keep a close eye on you, we're not going to give you misoprostol. So the first step of abortion pill reversal is already the standard treatment for women in this situation. The second step, however, is not standard treatment, but has been shown to be likely effective in recent studies, is that you give progesterone. And remember I said earlier that progesterone is just progestation. It helps the baby survive, it helps the pregnancy continue, it's a hormone, and that's its fundamental job. So that's the second step, and that is how abortion pill reversal works. So, as I said, sometimes women don't want to have an abortion. Either they're being coerced into an abortion, or they've accidentally taken mifepristone in rare situations, or sometimes she has changed her mind. She's had the first pill, and then she decides very quickly, that was a mistake, I don't want an abortion, how can I save my baby? So there are many women in these sorts of situations. As I said, about 1 in 4 women having an abortion are coerced by someone else. So it's a very common situation. And as I said, the current treatment for that is just to do the first step of abortion pill reversal, to say, we're not giving you misoprostol, just carry on and hopefully the baby will survive. And as I said, if you do that, the chance that the baby will survive is about 10 to 25%. So it's unlikely, but it is possible. So what is the evidence that adding the progesterone works? Well, as we saw, the authorities, or many of them, say that there's no evidence for it. So let's look at the evidence for it. There are 3 kinds of evidence. The first is that it makes sense in theory. This is Harvey Kleiman, he's the director of Yale University's Reproductive and Placental Research Unit. So he's really a really world-class expert researcher in pregnancy and how it works. And he doesn't go into abortion pill reversal in detail, but he was interviewed about it, and he said, it makes biological sense. It makes perfect biological sense that if you give progesterone, the baby has a higher chance of surviving. And he even went to say if his daughter had accidentally taken mifepristone, he would probably recommend giving some progesterone and seeing if it works. So this is a really top, presumably, I think he is pro-choice, expert in this area. He said it makes perfect theoretical sense, and it's perfectly intuitive and rational before you look at the evidence. Then, of course, we do have evidence. The first type is animal studies, which you normally do first before any clinical research. And we have multiple studies showing that when you block the action of progesterone in rats, usually, it causes them to have abortions. But if you then give progesterone, the rats no longer have abortions. So they have effectively done abortion pill reversal in rats in controlled experimental environments and shown that it works, which shows that the basic mechanism is sound and biologically makes complete sense. So then they went to study in humans, and there have not been many studies on this. There's only one major study, though more are going to be published in the next couple of years. As I said, what they've shown in earlier studies is that if you just take mifepristone alone, and you don't take misoprostol, you have a 10 to 25% chance that the baby will survive. So they said, okay, let's find a load of women who want to keep their baby and give them progesterone, the second step, and see if that 10 to 25% chance improves. And that is exactly what they found. Now, the survival of the baby in these situations depends a huge amount on how far advanced the pregnancy is. If you give mifepristone, the abortion pill, at 5 weeks, it's very unlikely the baby will survive. If you give mifepristone at 20 weeks, the baby is actually quite likely to survive. So it depends a lot on how far along the pregnancy is. But you can see that even when the baby is just 8 weeks, for example, where if you only give mifepristone and you don't give progesterone, you don't give misoprostol, the standard treatment, you would expect about 10 to 25% of those babies to survive. What they found is that when you give progesterone, about 60% of them survive. So it's a huge improvement. It's not a guarantee. If you can't say to a woman, just take the progesterone and your baby will survive. That is not true. Unfortunately, many of these babies still do not make it, even if they are given abortion pill reversal. But it significantly increases their chances to probably, we think, about 50% on average across all of the gestations. As I said, there's only one major study that's been published so far, but there's more to come out soon. The data we have from the UK suggests that the chance of the baby surviving after progesterone is around 40 to 50%. So it's significantly higher than if you don't give progesterone. So the evidence for this is actually pretty clear and is pretty compelling. But what about the second kind of objection? You remember the people earlier said it's not only unproven or untested, it's also unsafe. If you do abortion pill reversal, women are going to die or they're going to have massive injuries as a result, because this is completely rogue, dangerous, unsafe practice. Now, remember I said earlier that abortion pill reversal has two steps. The first is current practice, which is just to not give misoprostol, the second pill. The second step is to give progesterone. So given that the first step is already standard treatment, any concern about safety has to be about giving progesterone, because we know that the first step is safe, because that is what everyone in the medical profession already does, or at least we hope that it's already safe. At least no one is complaining that the current treatment is massively dangerous. But the problem with saying that progesterone is unsafe is that progesterone is also very widely used in these situations. This is a quote from the chief executive of NICE, which is our clinical guidance regulators. They're pro-choice, just like everyone else in the UK. But she says, "It is devastating for a woman to experience a miscarriage, so we are pleased to recommend progesterone for those women who experience bleeding in early pregnancy and who have had at least one miscarriage." Basically, what she's saying is that there was new guidance about a year ago that if you are having bleeding in early pregnancy, which suggests that you might be having a miscarriage or the very start of one, and you've had a miscarriage before, you should have progesterone, and it will increase the chance that your baby survives. And it's the same dose of progesterone that is used in abortion pill reversal. So this is a widely used treatment. It's recommended treatment in the UK and in many other countries for women who are having a miscarriage or the very beginning of a miscarriage. So we know that the first step of abortion pill reversal is safe, not taking the misoprostol, because that is current treatment. We know that the second stage, giving progesterone, is safe, because that is also treatment for certain kinds of threatened miscarriage. So everyone agrees, when they're not talking about abortion or abortion pill reversal, everyone agrees that both steps of abortion pill reversal are completely safe. And yet there's this kind of crazy idea that putting both of those steps together is massively dangerous and is going to cause loads of women serious health issues. It's just made up out of nowhere. But I want to just give you, I'm not going to go into all the debate about this, but I want to give you at least something to defend these ideas against people who might come at you on the internet. Now, this is what anyone who knows nothing about this subject will normally respond with, because if you search on Google abortion pill reversal evidence, the first thing that comes up is this one study, and if someone you're speaking to who supports abortion doesn't know anything about it, that's what they'll do. They'll go on Google, they'll search abortion pill reversal, and they'll send you a link to this study. They won't read the study, but they'll send you a link to it. And they will say, but this randomized controlled study where they got women who had current treatment and women who had progesterone had to be cancelled because of safety concerns, because all these women were bleeding out and they were having hemorrhages. We had to cancel the whole study because it was so dangerous. So let's look at this study. Well, it had 10 participants. It was a tiny study before they cancelled it. 5 of them received current treatment, and 5 of them received progesterone. And so what happened to those women? Well, firstly, we know that, at least according to this tiny sample size, we can't draw many conclusions, but at least from this tiny sample size, it looks like progesterone was working. The women who had current treatment had a 40%, sorry, I got that wrong, 20%, it's 40% survival rate. The women who had progesterone had an 80% survival rate. So what I suspect happened is that they looked at these early results and they thought, crap, it actually looks like it's working. We better cancel the study and find some reason to do that. And so that's exactly what they did, but they had to come up with a justification. So they said it was massively unsafe. They said 3 women out of 10 had hemorrhages. Now, what do they actually mean when they say this? Well, when you look at it, 2 of those women who had hemorrhages, 2 out of 3, were having the current treatment. They weren't having abortion pill reversal. They were having the current treatment. So if anything, what this study shows is that current treatment for a woman in this situation is unsafe. And so the question is abortion pill reversal safer for the woman than current treatment? And in fact, it is. In the abortion pill reversal group that had progesterone, only 1 of the 5 women had a so-called hemorrhage. She did not need any treatment. She did not need a blood transfusion. She did not need surgery. She did not need any treatment at all. Now, in medicine, hemorrhage is extremely ambiguous. You can call almost any kind of bleeding a hemorrhage. There's a massive difference between a huge major hemorrhage that needs a transfusion and needs surgery, and then you could call a small bit of bleeding a very mild hemorrhage. And so what has probably happened is that this woman who had progesterone, because she had had the abortion pills, she had had some bleeding, as everyone who has the abortion pills does. She had some bleeding, so they said, okay, this looks like a little bit more than normal because you've had an abortion pill, you've had a hemorrhage. And they said, oh, we've also given you progesterone. So therefore, this woman who had progesterone had this hemorrhage. As I said, she did not need any treatment. She was absolutely fine. When you looked at her blood results, her hemoglobin levels, her blood levels were a tiny fraction lower than normal. And so they've really baked a huge story out of this, out of really nothing. And in fact, the experts who looked into this case decided that this was probably just from the abortion pills themselves. So all that to say, just to summarize, because I know there's a lot there, they did this study. They compared current treatment with abortion pill reversal. They found that current treatment caused a reasonably significant chance of hemorrhage for these women. But they found that abortion pill reversal didn't cause any major hemorrhage needing treatment. And somehow they concluded that this whole study was so dangerous because of abortion pill reversal that it had to be cancelled and no one should ever study it again. It's absolutely crazy. And so this claim that you will see as soon as you start posting about this on Facebook or TikTok or whatever you young people use, they will say, but a randomized controlled study showed that it had to be cancelled because of safety concerns. And so my verdict, trying to be a young person, is this. Okay. So I want to just spend a little bit of time in closing just sharing a little bit about what changed my mind when I was at medical school. I finished medical school in 2015, and when I started medical school in 2009, I was pro-choice, like 95% of my country. And it was really a mix of looking at the science and looking at the philosophical arguments from a secular perspective that really convinced me about this issue. So firstly, where can we start, especially if we're speaking to people who might not be religious, as some of you may not be religious as well? Well, a helpful place to start is here, that every human being has the inherent right to life, and this right shall be protected by law. This is in international human rights law. This is in the International Covenant on Civil and Political Rights, which for anyone studying international law knows is one of the key foundational documents of international human rights law. Everyone should agree with this. Every human being has the right to life, and it doesn't say that that right to life can be violated or disposed of by someone else's choice. It doesn't say if that life causes you inconvenience, you can get rid of it. It doesn't say that it's up to the individual person. It says this right shall be protected by law. So what this means is that the central question about abortion is the child or the embryo or the fetus a human being? If it is a human being, then it has the inherent right to life and shall be protected by law. If it isn't a human being, then who cares? Do whatever you want. But that is the key question. And in fact, as most of you will discover, most people already agree that this is the key question. So here's a tip for having these conversations. What you can do is ask someone who's pro-choice, are there any restrictions you would put on abortion? Suppose someone has an abortion at 38 weeks because the baby is a girl. They've only just had an ultrasound at a late stage, or they had their gender reveal party. They found out that the baby's a girl and they don't want a girl, so they have an abortion at 38 weeks. Is that okay? And they will probably say, oh, that doesn't happen. We know it does, but ignore that. Just say, suppose it did happen. Would that be okay? They will usually say no, unless they're really, really radical. In my country, 0.5% of women will say yes, even that's okay, but 99.5% of women, according to surveys, will say no, that's not okay. So what that means is that almost everyone says that some abortions should not be allowed. And what that means is that almost everyone agrees that there are some things more important than the bodily autonomy of the mother. There are some things that outweigh the bodily autonomy of the mother. So you can say to them, okay, so if you won't allow a woman at 38 weeks to have an abortion, why not? Why are you against her choice? Why are you a misogynist? Why are you against human rights? Why are you against healthcare? And they will have to come up with some reason. And whatever that reason is, and they will normally say, oh, because it's fully developed or because it's a human being, what they are essentially telling you is that the baby being fully developed or being a human being or being viable is more important in this situation than the woman's choice to end their pregnancy. And so what that means is that you don't have to argue someone from a radical pro-choice view to a radically opposite view. You can say, look, we agree on the basic principles. We both agree that at some point, for some reason, abortion is not okay, and that there is something that outweighs the woman's right to choice. Now, since we both agree that once the baby is a human, or once the baby is a person, or for whatever other reason, that should be the most important consideration, let's think about that central question: when does it become a human being? And so that is how you can try to make some progress on this issue. Of course, we have to be careful when we talk about the beginning of life and what that actually means, because we often say life begins at conception or humans start at conception. And this is actually a bit ambiguous. Because, of course, we know that life started a long, long time ago. Life didn't start 31 years ago, in my case. Life started, my mother was alive, her mother was alive, her mother was alive, and so on for many, many generations. So it's helpful to be more clear about what we actually mean. Moreover, we know that bacteria and skin cells are alive, but they don't have a right to life. So what are we actually trying to say? Well, when we talk about something being alive and having the right to life, or being human, we can answer the question by thinking about, what am I? I am a human being. You are human beings, hopefully most of you anyway. And we have the right to life. So what does it mean to say that we are human beings with the right to life? Well, what it means is that we are individual members of the human species. We are individual organisms of the species Homo sapiens. And so the specific claim that we're trying to make is that an individual human organism begins to exist at fertilization. And it's helpful to have some clarity about that, just so that people can't talk about bacteria or talk about your mother being alive or whatever else. So that is the claim. And when that claim is made more clear, we know that the overwhelming majority of biologists agree with it. This was a survey from a couple of years ago. A guy from Chicago surveyed the general public, and he said, who is the expert on when life begins? And 80% of them said biologists. This is a biological question. And that makes sense because biology literally means the study of life. So we know that this is a scientific question first and foremost. So he then surveyed 5,500 biologists to ask them, not when does life begin, because that's vague. He asked them, when does an individual human organism begin to exist? Is it at fertilization or not? And when he was clear about what he was asking, 95% of those biologists said it begins at fertilization. He even wanted to check that he didn't just survey the pro-life biologists. He was surveying everyone. And so he asked, are you pro-choice, very pro-choice, or whatever? He found that even the large majority, 70% of very pro-choice biologists, still agreed that life begins at fertilization. So finally, I just want to give you a couple of landmarks of fetal development. Now, none of these are defining for when life begins. The baby doesn't begin to be alive when it has a heartbeat, when it can feel pain. But what this shows is that from the very beginning, this is a growing, developing, maturing human being. So we know that about 3 weeks, 16 to 22 days, the heart begins to beat. And your heart in your chest right now has been beating every single second since just 16 to 22 days after fertilization. If your heart's not still beating, go and see someone with a lanyard, but hopefully it is. That means that just by the end of week 4, the heart has already beaten 1 million times. We know that the baby begins to move by itself at 4 to 5 weeks, that at 6 weeks you can record coordinated, recordable brain waves from the baby. At 7 weeks, the baby has taste buds and it can hiccup and suck and swallow. At 8 weeks, the baby begins to practice breathing in the womb. At 9 weeks, the baby is yawning. Now, this is really strange because the baby is sleeping almost all of the time, and then it wakes up, it starts yawning. It might seem strange, but probably most of us have been in that situation. #relatable. At 10 weeks, the baby can feel pain, we think, very likely, but it's always impossible to prove that with certainty. And at 12 weeks, the baby can interact socially. Now, how could we possibly know that? The baby doesn't start talking inside the womb. But if you have babies in the womb, they will move their arms around like this all the time. And when they get to their eyes, they will slow down because they don't want to injure their eyes. What they found is that when you have twin babies in the womb next to each other, these twins will move their arms around in the same way all over the place. And when their arm moves towards their twin brother or sister, towards their head or their body, they will slow down because they recognize that this is something else that should not be injured, that needs protection for it. We know that babies at 14 weeks, when they hear a song sung to them, they can actually begin to move their mouth and tongue in response at just 14 weeks, just after the first trimester, or the end of the first trimester even. At 15 to 16 weeks, the baby begins to respond to taste. And we know that later in pregnancy, the baby even remembers tastes. So if you want your baby to like particular foods, you have to eat those foods in the 3rd trimester, and there's a higher chance that your baby will like them. So it's a very practical tip. Another practical tip is that if you want your baby to like music or a particular musician, you can play the song and sing the song to them in the womb in the 3rd trimester. So, of course, there are no obvious choices. It's your personal preference, although the obvious choice is Taylor Swift. But you can really get the baby to learn it from the 3rd trimester. Does anyone in here like Taylor Swift, by the way? Okay, so there are a few Taylor Swift fans and many, many people in denial about it, but that's okay. The baby even learns accents and their mother's voice and their mother's language in the womb. So there was a study that came out a few years ago showing that French newborn babies came out of the womb crying in a French accent. And German babies cried in a German accent. Now, I have no idea what that actually sounded like, but it's what the study found. So they begin to learn the accents in the womb even. And most remarkable, this is something that really amazed me, and I was surprised it wasn't more widely known. You probably heard all this debate about stem cells and the way that stem cells from research can be used for treating people from diseases and research and so on. Well, what's less known is that the baby, the unborn baby in the womb, already produces stem cells and sends them around her mother's body to heal her from diseases. These stem cells are given out by the baby at just maybe 2 to 3 weeks after the baby is produced or created. And they go around the mother's body. They can heal her heart from a heart attack. They can heal her skin after a skin wound. In one case, we know that a woman who had an abortion still had stem cells from her unborn baby inside her, which healed her liver after hepatitis. Now, this is an incredible thought that so many women, not only who have delivered babies, but women who have had stillbirths or miscarriages or even abortions, will in many cases still have part of their unborn baby inside their body, protecting them and healing them from diseases. It's an incredible thought. We know that in many cases, the stem cells even become part of the mother's brain, which means that someone who has conceived a baby in the womb, there's a good chance that they will even be thinking every day with the cells of their unborn baby. And so when you hear people say that this is just a parasite, the baby takes from the mother and doesn't give anything back, even aside from any statistics about mortality, which we can go into another time, we know biologically this is not true. This is a beautiful relationship of symbiosis between the mother and the child. So I've probably gone over time, so I won't go into the videos in detail. These are just pictures from my medical school textbook or images. I will just show you one image, because people will sometimes say, people will sometimes say at the very beginning, in the first trimester, it's not a baby. Yes, at 20 weeks, it's probably a baby, abortion's probably bad, but in the first trimester, it's okay. If the baby's really early, it's just a blob of cells. Well, this is a baby at just 7 weeks, under 7 weeks, after fertilization, in the first trimester, around the time that most abortions happen. And they managed incredibly to get a camera inside the womb to video the baby as it is in the womb. And this is what it looks like. You can see the heartbeats there. You can see the baby's eyes. You can see the baby's fingers, which are still separating, but they're still clearly visible, and so on. The heartbeat is pounding, pounding, pounding away. As you can see there, and some of the tummy organs. This is just 7 weeks. So when people say, oh, if it's that early when most abortions occur, it's fine, it's just a blob of cells, we know this is not true. Even at this very early stage, it has a clear form, it has clear organs that are functioning, that are working. It is a living human being. Well, thank you so much. I hope we still have a little bit of time for questions. Yeah, thank you.